Welcome everyone to my YouTube channel, Smoothine again, and today I'm going to solve a USMLE Step 1 UWORLD question of the respiratory block. A 60-year-old woman is brought to the hospital due to progressive shortness of breath and cough for 2 weeks. The patient was diagnosed with right breast cancer and completed radiation therapy 6 weeks ago. That's a key word here. Temperature is 37.3 Celsius, slightly normal. Blood pressure is slightly decreased and pulse is normal. Respirations are 22 per minute, which is normal or slightly increased. Oxygen saturation is 39% on room air. Examination reveals inspiratory crackles over the right lung anteriorly. The lungs are otherwise clear to auscultation. Chest radiograph shows ground glass opacities. That's a key word here. In the right lung where radiation was delivered. That's our keyword for today. Laboratory studies reveals no significant changes. Acute radiation-induced lung injury suspected. Histopathologic examination would most likely reveal formation of which of the following? The correct answer here is the alveolar hyaline membrane, because the radiation-induced lung injury typically occurs following thoracic irradiation, for example by breast cancer, which damages the pneumocytes and vascular endothelial cells and initiates an inflammatory response by interleukin-1, tumor necrosis factor alpha, and TGF-beta. This immune response can have both acute, such as exudative alveolitis, hyaline membrane formation, and delayed, such for example the dense fibrosis affects the typical manifest with cough and dyspnea. Now we're going to discuss this picture here. First we got the therapeutic ionizing radiation, then the generation of the reactive oxygen and nitrogen species, and then the DNA and cellular damage. Then the inflammatory response, which is the leukocyte infiltration, excess cytokine, such as, for example, interleukin-1, interleukin-6, tumor necrosis factor alpha, TGF-beta production. And then we got the acute manifestation for 3 to 12 weeks, which is impaired gas exchange, for example, by alveolar edema, pneumocyte sloughing, and hyaline membrane formation. That was the answer for our question. We got here the radiation pneumonitis. Then we got the fibroblast proliferation with collagen deposition, the delayed manifestation, which is from the 6 to 12 months, which is the diminished lung volume, intimal and subintimal fibrosis, and then finally we have the pulmonary fibrosis. And thank you for watching.